Hi, Steve from Wandsworth Physiotherapy and Osteopathy. Shoulders are probably the third most common things that we treat here at the clinic, and there's a particular diagnosis within shoulder problems called calcific tendinitis, and we see a number of people with this condition. And as the name suggests, some calcium develops within a tendon in the shoulder. So it's most typically in the supraspinatus or infraspinatus tendons, and it's a soft form of calcium. It's not bone, it's calcium hydroxyapatite, and it's almost like when you leave the cap off of toothpaste and you get that sort of crusty rim and the soft underbelly of that toothpaste. Now, we're not really sure why these calcium deposits end up in tendons, and they can occur in other tendons in the body, the patella tendon, the Achilles tendon, and they can be quite uncomfortable, quite painful. And there's probably two common presentations that we see. So first of all is the patient just with sort of non-specific diffuse shoulder pain. They sometimes have this sort of painful arc, or they feel that something's getting caught in the shoulder as they lift, or they do things, or they have to sort of flick their shoulder to take a t-shirt off. They might have some impingement when we test them, and they might be a little bit weak in their rotator cuff muscles, not terribly weak. But when we ultrasound scan them, we can see this quite well-defined calcium deposit within the tendon. So it almost looks like a little pea of calcium within the tendon. Now, the second presentation is what we would probably term this really acute, severe calcific tendinitis. Now, these people are pale. They're in excruciating pain. They've been to their GP. A lot of the time they've already been to A&E as well because they're in so much pain. They've been prescribed muscle relaxants, painkillers, anti-inflammatories. Now, they're going through this resorptive phase where the body and the immune system is really trying to break that calcific deposit down and remove it. Now, both types of this calcific tendinitis or tendinopathy we can see quite well on ultrasound when we scan the shoulder. So we can see the well-defined calcific deposit in the more stable calcific tendinopathy, and we can see the real diffuse inflammatory reaction on this resorptive calcific tendinopathy. And there's two different management strategies. So the person that's in real severe acute pain, I mean, they need pain relief, and probably one of the quickest, best interventions is to do an injection of local anesthetic and steroid into the bursa, and within a few days that really significantly helps settle their pain down. Now, it doesn't remove the calcium, but it really significantly helps the pain. Now, once that pain has settled down, then we can do other interventions, and this is also the case for the more sort of stable calcific deposit. Now, one treatment method we've got is shockwave therapy. So that's an external shock, and it's a pressure wave that's delivered into the tissue, and it's to try and break down and help remove that calcific deposit. Now, it's not immediate, it's going to take time, and the treatment is really there to stimulate your body to get rid of the calcific deposit. Or there's another injection that can be done, and it's called a babotage lavage process, where you try to break up that calcific deposit with a needle tip, maybe try to plunge and suck some of it out with a syringe, and then also put a little bit more steroid into the shoulder. Now, again, those are treatment methods to try and remove the calcific deposit, but you're then also going to need to strengthen up the rotator cuff and do your rehabilitation to fully recover. So if you've got a painful shoulder and you're not really quite sure what it is, or if you've had a scan, you've been told you've got calcific deposit, or you've experienced this extreme, severe, sudden onset of shoulder pain and you really can't move your shoulder in almost any direction, pop down to see us at the clinic and we'll certainly be able to help you get on the right track to recovery.